Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
It's an article that I suggested you take out, but you can leave it in if you can find the 10 lifestyle habits to decrease your risk of cancer, which they talked about. They talked about a program that they're going to have tomorrow. But anyway, if you can find the 10 healthy facts they talk about, I couldn't find it. That's why I told you to take it out. But if you can find them, fine.
No, this is the invitation to the session.
Right, yeah. That's all it is, an invitation to the session.
Don, can you
There's a
You can go to the next one because
can
that's all.
you click on that link?
Yeah.
Yeah, but all it does allow you to register. So
Yeah.
you don't waste time. Let's
Okay.
go to the next article. Yeah. The 11 biggest benefits of walking. And this is an interesting article because we talk about many exercises. We don't talk a lot about how just walking can do so many different things for you. And of course, John Buchanan takes what is your hour or 2 hour walk?
It's about an hour and 40 minutes. I did 6.6 day before yesterday. I did 6 yesterday. And I tried to do it three times a week.
That sounds good. And anyway, it's interesting. You see how they talk about a glass of wine or dark chocolate can help you with a little stress as well. But the fact that walking can improve your mood. Remember we had a lot of talks about mood with Dr. Bland last week. And so helping with stress is one thing it does as well. It doesn't burn a lot of calories, but it does help, and especially if you're on a diet that has few calories. But if you it's not as great in terms of losing weight as it is when you're living longer. But it does do that as well, especially if you walk 6 miles as you do.
It's you might think that it's strange about going out on a really cold day.
You muted.
A really hot day, or you'd be surprised how when you're moving on a hot day, it cools you down, and when you're moving on a freezing day, you really don't need that many clothes on, except maybe to cover your face, to make you comfortable while you're walking. You just get to that level, and it gets comfortable, really.
I think you're right, and you also, when you get up to 100 degrees, then that walk will help you lose weight. Yeah. Well, I think it's an easy way to improve your health, and it talks about reducing your risk of chronic diseases, which lowers your blood pressure as well, and so another benefit of walking. Delaying the onset of varicose veins. That's an interesting concept. I don't know how much it can delay it, because sometimes they're inevitable. But walking is good for the circulation, the venous circulation. So, and of course, it helps you to have bowel movements and helps your digestion. So it's another thing that's good. And also, if this is one of your goals, reaching goals becomes stress reducing. So, yeah. And so help you become creative. It can help alleviate some joint pains. Some joint pains make it so bad you can't walk. But anyway, the earlier you start walking, the less likely you are to have some of those joint pains. The fact that it can boost your immunity is something that is also an added value. And of course, when we're talking about COVID, it's something you want to do. And then some people think it can help you live to be 100. Well, it shows that people who are active live longer than those who aren't active. The only thing it doesn't tell you is that if you can't walk, then you can't be active. So it's kind of a double-edged sword. And it helps you sleep, which is another benefit. Now, this talks about the melatonin. Any of you take melatonin for sleep? Because you can find 50% of people who take it say it helps, 50% who say it doesn't. Anybody take it for sleep?
Charles does. What did you say about it, Dr. Cal?
Anybody take it for sleep?
Yeah,
Melatonin.
I do. This is Sylvia.
Does. My husband does too.
Does it
Yeah.
work?
Yeah. My husband said yes.
Oh, good.
Yeah, this is Sylvia. I take it and it does help when I can't fall asleep.
Okay, good. Well, it's one of the drugs for sleep that doesn't have many real side effects, so it's safe to take. Okay. Now this is we talked about depression last week, and one of the things that we didn't talk about is the fact that in children it has doubled, especially in Black children, and the isolation and other things that have gone along with COVID have made mental health and anxiety a real crisis. You can see how it's more than doubled, and the isolation is probably the biggest part of it. Social isolation is one of the most important things that helps us to mature and grow. Taking it away has done a lot of bad things for our children and adults. Adults have gained weight and been depressed and anxious.
Dr. Callender, there was a report that a lot of Black parents are not sending their children back to school. You know the rationale for that?
No, I don't, because it's not a good idea. I don't know why they're not sending them back to school.
Okay.
Have you read anything about it?
I've heard a lot of, on news reports, they said that Black parents are, especially, I've forgotten which areas, but they decided not to send their children back to school because of their response to the COVID. But I was just wondering why our race, particularly, especially since our children are suffering from depression more.
Well, I guess that it's probably related to lack of information, because that's one of the worst things you could do is, although there are some parents who are going to home train them, if you're expert at it, it has its advantages, but there's so many disadvantages that it's not a good idea. So I don't know the reason why they're doing it. It's a question. Now, this is a study that in a lot of the COVID studies are more applicable to the earlier variety of COVID viruses. And some of this has changed in the Delta, because they said that 1 in a million children would get COVID. And that is true for the risk of death. And The question is that also true for Delta? It's probably not as true for Delta in the sense that they will get infected, but the serious consequences of the infection, however, are not clear for Delta. But you can see that the risk of COVID in England in children was not common, and you can see this slide kind of tells it all in England anyway. How much this is transferable to us remains to be seen. So the question is, and we're talking about children, we're talking about people under 12, and the question was not so much as whether children needed the virus, needed the vaccine, but certainly the adults need the vaccine. The teachers do. So it seems that the risk is greater for the teachers than it is for the students. And this also brings up a question: is the risk-benefit ratio sufficient for children under 12 to get the coronavirus vaccine? That's a question that remains. And it'll take time for us to get the data on the Delta because this is only up to February 2021, and much has changed with the Delta variant, although this article doesn't recognize that, but it has changed. Now, this is an article I included because it's interesting that people have concluded that women are healthier than men, and that's because they live longer. And we won't even talk about Bobby Riggs and his claim that a old man could beat a young woman, and had a $100,000 purse that Billie Jean took from him because he was wrong. But as you look at it, there is evidence that the estrogen is protective in women, and maybe one of the reasons why they live longer. Whether it's that extra X chromosome or the estrogen that is a consequence of that remains to be seen. But the data does allow one to conclude that in many areas, of course, when we look at longevity, we know well that the difference between the age of death for women is 79 versus 72 for men. And here again, they talk about estrogen combating some of the things that men die from. And so, but it's interesting for transplantation, that's not the case. It's interesting that women are more often donors than men, and their success rate in transplantation is not quite as good as men in many instances. But in the final analysis, it does appear that women are healthier than men, and they live longer. Now, some may wonder, does that mean that women are also as smart as men, or smarter or less smart? And of course, there aren't very many articles on that, but I'm led to believe that they at least are as intelligent as men, and maybe more so. It's funny because when you try to get something done efficiently and efficiently, many groups are most dependent upon the female of the species. And that makes you wonder. Any questions about that before we go to the COVID vaccines?
Yeah, I have a question. The fact that you're talking about the efficiency of women and everything, sometimes people believe that secretary and woman are synonymous. You know, secretary, most secretaries are women.
It's kind of the same thing I was getting ready to say.
Well, but I don't understand. But what does that mean? All that means is that women have, that's a job that they have decided that women can do. That doesn't mean that that all secretaries should be women. And just like nurses, most nurses are women, and it may well be because that's a job that they've decided to give to women, and also because maybe because women are more sensitive than men and more generous than men. I don't know, but yeah, that is true about secretaries. But I think it's a self-fulfilling prophecy.
And I think recent history has shown that the stereotypes, I think, have drastically changed. There are a lot of male secretaries, definitely male nurses. Of course, it's higher females in those categories, but recently it's changed. It's quite different than it used to be years ago.
Well, didn't we say one time that a female doctor has more emotional intelligence than male doctor?
No, we did not say that.
We did.
No, what we said was that if you ask patients, they think that the female doctors are more sensitive, and they didn't say anything about emotional intelligence. They talked about sensitivity, other things. Anyway, I've always rejected that, but patients haven't. Patients have identified women as being the better doctors.
Yeah.
Because they're more sensitive and they made better doctors. That's what the patients have said. So
So Dr. Callender, the patients have also said that if they're in a hospital and they're sick and everything, they would prefer to have a female nurse. Females would prefer a female nurse, and men would prefer a female nurse.
yeah, well, as has been stated. Now, of course, when you go to the hospital, still, while there are more male nurses, you're still about 8 to 2. The male nurses are still not common, but there's certainly more than there used to be. Used to be none, rare. Now it's common, and
It goes back to what was a sign years ago. You know, the women just did those jobs. That's what they gave us, and men did the other jobs. So that goes for secretaries, nurses, anything like that. They just thought that was a woman's job. So back when, so it's just beginning to evolve.
We have a guest on our call, a participant, Reverend Carlos Younger, and I'm sure that he can unmute. He's using a nurse now, and I bet you he could tell us a little bit about his situation and his preference between a male nurse and a female nurse. Carlos Younger.
Good morning, everyone. Thank you, John, for putting all my business out. No, I very unique. I had a male attendant, and now I have a female. And only reason for change, he wouldn't work 2 cents. But I preferred a male because if I get into a situation where I need to keep from falling or being transported, I just couldn't do it myself. I felt that the male would be more equipped to make it happen. But then from a wash my body type thing, also I'm more inclined to would want I feel more comfortable, that's a good word, with a male. And I think that's the situation. It depends on what you feel more comfortable with. I think men feel more comfortable with men in that regard, and women obviously more comfortable with women. That's my 2 cents.
Well, thank you for your thoughts. Any other thoughts on the subject?
Yeah, I got a couple thoughts. I always prefer a female doctor because I think they're more empathetic or higher emotional intelligence, and I like to support my sister. And then I like to support my sister. Then the other thing is that, like you said, estrogen seems to be protective for health. And one of the biggest enemies of women's estrogen is consuming alcohol because it depresses production of estrogen and increases production of testosterone. So women got to be careful about drinking. And then it seems that the more pregnancies a woman has, it delays the onset of menopause, which could be very helpful to women's health and promotes longevity. So when the Bible said, be fruitful and multiply, it's talking about how women can be healthier.
So how many children do you have to have before? I want to know whether I need to go and have a couple more.
Yeah. Okay. Well, it's interesting to hear the different opinions about it. Let's go on to the next one. This is an article that is timely because, and you notice it's a British article because they have the Delta variant before we did. And it's interesting to see how they compared the effectiveness of the different from the Moderna and the Pfizer. And we talked about it a little bit last week. And as time goes on, it becomes clearer that the Delta variant is more problematic than the other variant. And we have more breakthroughs, of course, with the Delta. And this then is making us get to the point, as somebody mentioned earlier, that the CDC and other groups are now indicating that that's the reason they are supporting having a booster shot after 8 months, primarily because of the breakthroughs that occur with the Delta variant. And so this then caused one to look at all of the different viruses to see how they were affected by the Delta variant. And you could see that they all reduced the risk of death by more than 85%, regardless of the variant. But there's data that you see down below that suggests that the Moderna was even more effective than Pfizer, and that AstraZeneca was the least effective of the three, although all of them are effective against Delta. But you can see how fully vaccinated people are testing positive and actually dying from Delta. Most of them survive, but it's still clear that the Delta variant is more resistant to some of our antibodies, and there's also data that suggests that those people who only receive one shot are less effective at throwing off the Delta variant. However, there is enough evidence to support the use of recommending a booster dose for those who after 8 months, which is the line that they're taking now. Of course, that means that the vaccine producers will make a lot more money, but it's the issue is the fact that it may be beneficial. And
Dr. Callender, where did they get the 8 months from? Did you mention that?
all I think they decided that after 6 months, there was some evidence that the amount of antibody titer was decreasing, neutralizing antibody was decreasing. And so they theorized that maybe that would be the time to take the booster.
Thank you.
There's another article that talks about wise or wasteful. And I think that before the Delta variant, most people thought it was wasteful. That has changed. And that has nothing to do with the immunocompromised patients, because that's a different story. They need the booster, and there are many studies that demonstrate that their titers are increased with the booster shot. But for the other people who are not immunocompromised, the booster shot has become particularly important now that the Delta variety and the Lambda variety looms large. So that, as we all know now, that they've come out and identified that everybody should get a booster shot at 8 months. And of course, around that time is a time for some to start their flu vaccine, which I don't recommend before October. But anyway.
I had a question, Dr. Callender. Is there any kind of recommendation about getting those 2 shots at the same time, the flu and the COVID?
There's been no recommendation yet, but I don't see any problem with getting them at the same time. But there's been no recommendation yet.
Dr. Callender, for the boosters, do we have to get the same shot? If we got Pfizer first, you get Pfizer again and not one of the others?
I don't think it matters. But if you can get the same thing, it's probably desirable. But I think as long as it's the same type, for example, if it's Moderna and Pfizer, both are RNA viruses. So I'm sorry, vaccines. And so it probably would make a difference. For the Johnson & Johnson, it's suggested that you get one of the RNA vaccines. But however, the Novavax vaccine, which has not yet been approved, has potential to be effective as well, but that has not yet been approved.
Dr. Callender.
Yes.
Mr. Carlos here. Just a point of clarification, because I don't remember, but my son keeps fussing about this, and I want to refute him if I can. The Moderna and the Pfizer, they both received clearance through the, what's it called, the FDA? Whatever.
FDA.
Yeah. Is it correct?
Yes.
Okay. So on
FDA
go ahead.
approved Moderna and Pfizer and Johnson & Johnson.
Okay.
So both of those were emergency approval.
All of them are.
Okay. Oh, okay. Emergency approval.
Yes, all of them are emergency approvals.
All right. All right. I'll let him know you can stop fussing and go get his shots.
Yeah,
he claims If they approve, I'll take them right away. Like what?
Well, there's emergency approval now. Now maybe he's waiting for there's another type of approval that he may be waiting for, because there is a different type of approval which has not yet been obtained.
Okay, what kind of approval that?
That's in other words, all they have right now is emergency approval. That's the only approval they have.
Okay.
So
Let's say our normal medicines that we deal with every day, they went through
the first phase, which is emergency approval. Then they got the full approval.
Okay, so these are missing the full approval.
That's correct. Well, it's not. It is. You're right. In a sense, it's done under emergency because it was desperate to save people's lives. But after a period of time, you need to apply for the full approval, which has nothing to do with the emergency. And that may be what your son is referring to.
Okay, okay.
Because the flu vaccine has the approval and has nothing to do with emergency.
Mm-hmm. Got it. Okay, cool. All right, thank you.
Okay. And this, of course, is something that and I guess Mr. Tatum already has gotten his third shot, but studies have demonstrated that people who are on steroids, immunosuppressed, their immune titers doubled after the third shot. So it is now recommended for those patients, transplant patients, people undergoing cancer treatment and HIV required a booster shot. Any other questions about this? Because I think we've talked about this sufficiently, perhaps. And this then, of course, is the most recent August 17th recommendation that boosters at 8 months. I think the earliest would be September, because that's when most people started getting the doses, December and January.
Dr. Callender has also recommended that people over a certain age
Over 50, yeah.
get the third shot, yeah.
Right. Mm-hmm. Now, some people are concerned that this is going to decrease the amount of vaccine available to developing countries, and it remains to be seen. Anybody have any thoughts about, I think Bill Gates was in one of the papers that we didn't study, talked about the importance of having the vaccine available for all human beings, and talked about the fact that it is in our best interest to have all humans vaccinated, because then you don't have these variants coming out. And so one of the interesting things to appreciate is that while we talk about institutionalized racism in the United States, which it is certainly noted for, that kind of putting one group over another is common in all countries. And I think it's something that is killing us. And we got to get to the point where we don't have a majority minority health disparity, but we have everybody that has the same kind of health care. We don't have that in the United States. There are some countries that have universal health care, but we don't. And this is something that we need to fight for.
I had a question, Dr. Callender. There's a radio ad I listened to yesterday. I had to turn it off because it was so stupid, but I want to just throw it out there. They were talking about President Biden was giving away our our vaccine technology to China and Russia. Is that retarded or I mean,
what do you mean giving you away? I don't understand. You know, one of the things about theoretically about medicine is that you try to make it, whatever advances you make, you try to share with everybody else. So that should be the natural thing. And we shouldn't try to take it, keep it for ourselves. We should try to give it to everybody else. Why not? I think that's desirable. It's unfortunate. Some people look at it as something that we should keep in isolation, but that doesn't help us. That hurts us.
I believe so. I mean, they're politicizing science. It's very
yeah. Well, I think we should be opposed to that.
John, I saw that too, and I thought it was a Republican that was just putting that out to go against Biden. That's all. It was politics, but they made it seem like they were really, you know, America should not share anything with China.
That's unfortunate. People would talk like that. It goes again with the lack of understanding about the need for diversity, which is one of our most important characteristics. The more diverse we are, the better off we are. And the more we recognize that the world is getting smaller all the time, the better off we will be. Well, time will tell. This is an article that talks about how vaccinated people can spread Delta, even though they may have not developed the infection. And this article talks about it, how it spread. And it talks about how they tested the patients who were vaccinated and those who weren't. And they found that both groups could spread the virus, which is something that Buchanan had been talking about for some time. But the tests demonstrated that that is the case, that vaccinated patients can get the virus and can spread the virus, even though they are asymptomatic.
Yeah, I think it's the same thing with children, though, that even though they may not get sick and they come to school and they spread it. I think that's why all the teachers and staff are now mandated to get vaccinated.
Yeah, and it makes sense. It makes sense. Well, what is the situation now, John, relative to the teachers?
They're having a big fight right now about going back. The discussion is around CO2 carbon filters in every classroom. Teachers want that, and they want to have verification about the parents being vaccinated more so than the children when they come to school, because if the parents have it and they send their child, they give it to their child, who, as we know, won't even show signs of it sometimes. They come to school, then they can give it to the teachers. And the teachers may be fully vaccinated and still get it. So it's a circus. It really is a vicious cycle. But can you talk about the CO2 carbon filters in every classroom?
No, I know nothing about that.
They also have a device, a machine that you can put into a room, and it can tell you if the room has bad viruses in it or not.
I'm not familiar with that either. So.
Yeah, it can't tell you the names of the virus because, of course, that's impossible. There's millions of viruses, but it can tell you if there are some viruses in your environment that are harmful.
No, not aware of that, so we'll have to do some research on that. Now, many are concerned about the ethical aspects of this new mandate because all HHS employees are now mandated to take the vaccine. And many people think that's unethical. All the members of the military will be required to be vaccinated. What are your thoughts about it? Because that's the ethical nature of it is the question.
You know, that's what the Republicans, like DeSantis and those folks are saying, that the government should not be mandating this, that people can decide, you know, to get vaccinated or not. It shouldn't be the government.
What are your thoughts? I understand that. What are your thoughts?
Big brother, I believe the government should do that because, you know, the government takes on the responsibility of the health of the nation. And I mean, if you look at it, you know, we 650 million people died from this. This is a huge responsibility. People deciding to not get vaccinated, that's not working. That's killing people. So yeah, I believe it. The mandate is important.
Any other thoughts on it from
Yes,
from
and
you?
it's also a cost factor.
It's
The
like,
cost of trying to keeping the people healthy and so that they will not be attracted to the virus, and the cost of hospitalizing the people with the virus.
Any other
Becomes a
thoughts?
burden on everyone.
yeah, it's just as unethical to have unvaccinated people harm other people.
That's the most unethical. Isn't it? Any other thoughts on the subject? Because
I heard that talking about the military, they said that the military takes, they're supposed to, whatever their commandment, their officers over them tell them to do, they're supposed to do it. So
they
if
have
the
to.
officers tell them to get vaccinated, they should. So, I mean, they have to.
Yeah, that's correct.
Trying to say. So I feel like I'm more in favor of them mandating. I think if it came from one person and it president or the Fauci or whoever has the authority, it would be great if, but everyone isn't going to do it. But I think it would be great if they would comply if someone in authority said everyone has to be.
Yeah, and you see that California was the first state to require all teachers and school staff to get vaccinated or tested weekly.
I have a question about that, Doc. So if there are breakthrough cases, even though it might be a low percentage, what about having everybody tested weekly? You know, because breakthrough cases, even though they may not have symptoms, they may, what do you call it, asymptomatic, you know, they may not get sick, but they can spread it. That's already been documented. You know, I was thinking about, okay, you got vaccinated or you test every week, but what about the ones that are vaccinated that get infected and can carry it?
Well, the goal of his intention is if you don't get vaccinated, you should be tested weekly so that they know that you don't have the virus. Now, you bring up another issue, which is a separate issue, which is that, those vaccinated can be done as well. But his intent was to just get those people vaccinated. And if you couldn't be vaccinated, to be tested weekly. But that does escape what he's talking about. different issue.
What's the percentage of breakthrough cases so far with Delta? Do you know? Does anybody know that?
There's so many different studies. They have different versions, and I think seems like it's more like about between 20 and 30%, something like that.
Why did they come up? What about those other 6 days? I mean,
Other what?
the other 6 days, if they're going to be tested, if you haven't gotten the shot and they said you have to be tested weekly, once you get the test, I guess it will show right away. But what about you could get infected the very next day. So
That's true, but they don't want to do it every day. So once weekly seems reasonable.
I think maybe if they say every day, more people will do it, so they won't have to take the test.
Well, but once weekly is reasonable.
Okay.
This is interesting that 2 states count for nearly 40% of the new coronavirus hospitalization. And those are both states that have different ways of handling the vaccination issue. You see their vaccination rates are very low. And it's not like they change because the administrations in those states have different philosophies on vaccinations and mask mandates. So,
And the Texas governor got COVID.
right, that's right. Yeah, and DeSantis is well known for his opinion.
And Dr. Callender, it probably has nothing to do with the fact that those are border states.
Oh, I think it has a lot to do with the fact that they are border states, because a lot of people come into the country who are COVID positive and they don't know it, and so I think that's part of the problem. I think we have to do better about testing those people who are coming across the border, and if they're positive, they should be kept out. Now, this is an interesting article in which there are many nurses who feel that their autonomy is taken away because vaccine is mandated. And many nurses are part of this. And this is an interesting article because nurses feel they have the freedom to take the vaccine if they want to or not take it. And they do, but they don't. But they shouldn't be working at the hospital if they're not taking the vaccine, because the hospital should not be the source of the virus. And that's the argument that goes on. But there have always been groups who have been anti-vaccine, and this has not changed. While 95% of the doctors have taken it, significantly less of the nurses have taken it.
We only have, I think, just 1 nurse or 2 nurses on panel. I know Pearline's on there. Is there any reason? Okay, 95% doctors. I thought knowledge was power. Why are the nurses, they have the knowledge of it, why are they fighting it so? Maybe Pearline can address that. I know she can't speak for all the nurses.
I
Pearline,
really
did you-
cannot.
Yeah,
I really cannot speak for all the nurses, but I don't know why they're not taking it. I think they just don't want foreign stuff in their body. I don't know. I really don't know. I took mine.
I think that some of them are arguing that it should be up to me to make a decision about my body.
Basically.
Yeah.
And that's all that's good, but you can't work in my hospital. That's all.
Yeah, that's right. Yeah. And so far, the courts have supported that position. But it's interesting that in most hospitals, you still have about 30% of the staff that are not vaccinated. Now that will have to change by certain dates in September and October, because the rule is if you're not vaccinated, you don't have a reason, you will not be employed at the hospital any longer.
My brother and his wife just retired from the military, and they're refusing to take the vaccine. They don't trust the government.
Yeah. Well, this is another take on it. This is where in Tennessee they protested school mask mandate, and they are trying to punish those people who wear masks, which is interesting how people respond.
I saw an article today where a teacher was attacked and had the mask ripped off the face at school.
Yeah, well, you see so many unreasonable things that happen, and a lot of it is thought to be related to autonomy. But the autonomy is you have the right to wear the mask, just as you have the right not to wear the mask. But anyway, it's interesting how whatever position you take, somebody will take the opposite position, regardless of the wisdom of doing so.
It's just that a lot of those opposite people are from the South. I don't know what that's about.
Yeah. Well,
and Republican.
Yeah. Well, anyway, it's gonna have to be decided in the courts as well as other places, because it's very divisive and very dangerous.
Dr. Callender, there was a situation where in the court, someone was a criminal because they spread AIDS to another individual. They knew they had AIDS and they deliberately infected someone else with AIDS. And so they became a criminal and got arrested and probably did some jail time. My question is, do you ever think that we'll get to that point where somebody who has the virus deliberately gives it to someone else and then they become a criminal for that act?
It's kind of hard to figure out how. I don't know. That's an interesting question, because for the AIDS, there's one way of giving it by having sex.
Right.
Whereas with the virus, there isn't one way of doing it. You know, breathing on somebody, I don't know how you can say that that's an act. So I don't know how anybody could take somebody to court to say that they deliberately gave it to somebody else. Time will tell, but I don't know how they could do that. How you could prove that in a court of law.
Yeah, you'd have to pass laws making it a crime for specific acts.
Yeah, that's right. Yeah. Now this is it's interesting how the journalists paint things. This student dies after the governor doubles down against mask mandate. They're almost trying to say the governor's responsible for his death. Well, I think that's going a bit far, because the evidence does support the feeling that children die of COVID-19 rarely. Of course, if that's your child, that's 100%. But the data still supports the fact that children are not as often affected by it as adults.
Well, Dr. Callender, that's a case right there that would be tested in the court. Can the governor?
I doubt it.
You doubt it. Okay.
Well, the reason I doubt it is because how can you show that the governor, see the data, you remember we saw that graphic earlier that 2 of a million students die from COVID. So the data would support the governor's position. He could use that data to support his case. So it would be difficult. It just as Darrell had pointed out, you'd have to have laws that make it criminal offense, which we don't have.
This 13-year-old was in the band. She was a band member.
Yeah.
I was thinking when it first came out, the CDC gave all these precautions for music, vocal music, you know, was a mass. They said couldn't have band, orchestra, string orchestra maybe, but band because of playing an instrument. CDC still giving guidelines to music teachers. John Buchanan, you know about that?
I really don't know. I don't have any information about that. But you know, the college kids are going back to campus. I think the majority of them have to be vaccinated. I did freshman kickoff last Saturday for the Notre Dame freshman incoming class, and the band performed. We were all inside in a room, the alumni band, and you know, it just felt safe that you know, since all the kids were vaccinated, that was a much better and safer situation than just having it open, you know. And you know, the marching band practices outside a lot, but also they practice inside. So there's, you know, it's just like the football teams and the baseball teams that you see now. If everybody's vaccinated, there's much less of a chance of spread, you know. So I feel better about that, but it's still a chance now, you know. If everybody's not vaccinated, and there's no way to mandate that, I'd be very, very nervous about that.
We have our first choir rehearsal this Saturday. And everybody is supposed to be vaccinated, but there's no documentation of it. But anyway, the first rehearsal is this Saturday coming up, and it's gonna be interesting to see. I have a conflict, so I can't go. I'd planned to go, but this is National Radon Awareness Month, and I have many activities that make it impossible.
Do they have the singers' masks?
Yes, yes.
Now, the singer's mask, have you seen one?
Yes, it sticks out in front.
Okay. So how, other than sticking out, well, how are they different? How are they more prone? How are they different than the regular mask?
I personally don't know. I think Dr. Callender knows. I think you got
No,
it.
I haven't seen it myself, so I can't answer that question.
And I asked that question because when you mentioned in the last week's session, I went to Amazon and looked at them, and I talked to a choir director friend of mine, and we were both looking at them, and we were just trying to figure out. You know, you could tell me the sky is blue, but that doesn't mean it's blue. It might be gray. So I'm just trying to see the difference. So I'm you know, speak intelligent before I recommend something.
Yeah, when I get a chance to wear one and get one, I will give you my feedback. But right now, I can't answer that question.
Because I was wondering, other than the shape, would it have an extra filter?
I don't know, so
Yeah.
we'll have to find out. I guess nobody on this call has used one. So.
Dr. Callender.
Yes.
I went online looking at the singer's masks as well, and I read a little farther Now, I don't know if this still is, but I read that it has not been medically approved. So that spoke to me.
Yeah, it speaks. Yeah, as I say, I haven't done any research on it myself. Maybe by next week we will talk more about that.
Okay, for instrumentalists, I know I met a friend of mine that teaches wind instrument, trumpet, and they say they had something for the bell of the brass instruments, and I don't know if they're medically approved. And then when I was looking online, I saw a mask for a flute player and etc. that they have, but I was just wondering for the instruments, especially the brass instruments. I don't know about the flute, that's woodwind, but or what they have to protect from all of those particles coming into that.
There's really nothing you can do with a clarinet, a flute, a saxophone, bassoon, because all the keys are open all the time unless you're pressing down. So I mean, unless you're playing in a bubble, you know, which you can't be heard if you're playing in a bubble, it's impossible to prevent particles from escaping for any woodwind instrument. It's just not possible. I mean, I saw an attachment on a flute that goes over the mouthpiece, but that's good for the mouthpiece, but the air and the aerosols go through the instrument and come out when you lift your fingers up. So it comes out the end of the flute anyway. Clarinet, saxophone, all the oboe, bassoon, same thing with all those instruments. And a French horn, John knows that. You play with your hand in the bell with a French horn. You can't do that if you have a cover over the bell. So that's gonna that'll affect the sound of any orchestra or band with the French horns.
I'll tell you something interesting with the French horn. You can play stopped horn, STOPPED, stopped horn, and that means that you stick your hand as far as you can in the bell, and as if you were trying to stop the sound from coming out, and so it gives you a different sound, almost like a buzz sound, which is required in a lot of symphony orchestra pieces. But even with stopped horn, I think you're still going to get some aerosols because anytime there is sound coming out from anywhere, there are going to be aerosols.
Exactly.
I can see your beauty better.
Well, we'll try to get some answers to this for our meeting next week. Now, this is something that I thought would be interesting for us to appreciate. The fact that something we've known for some time is that we know that by 2050, the majority of the people will be non-white, and so it's now beginning, and we now have the data for the first time. The census is showing the white population is decreasing. And of course, the non-Hispanic, the Hispanic population has increased to more than 17%.
Excuse me, did you say the white population is decreasing?
Yes.
Well,
I'm sorry?
No, I said, well now.
Yeah, and it's what they feared and what Trump feared and the others feared, and it's coming to pass. And we're becoming much more multiracial and multi-ethnic, really is the term, because we're all one race. But anyway, so it's depressing for some because they are trying to, and Trump was all about keeping America white, and so they're losing the battle.
Well, they thought if they they tried to kill blacks off as much as possible. And then they got into our heads and told us to stop having children. The American way was to have 2.5, but they've never gotten to the Hispanic head about not having children. And